Hi, I'm Brandy Kirk from Kirk Center for Healthy Living, and today we're going to start a series on visceral manipulation. As most of you know, we specialize in visceral manipulation at the clinic, but you may or may not know what it truly is, even if you've been receiving it at the clinic. So I decided I would start a series kind of educating our patients, just like I educate our students that do this work, on how to do visceral manipulation, what it is, why do we really care whether organs can slide and glide and move, and things of that nature. So I'm going to keep it pretty simple. I'm trying to try not to use big scientific terms so that you can actually understand what's going on. So viscera actually means organs, and manipulation in France means to care for with your hands. So technically, this has been created by Jean-Pierre Barral, and I teach for the Barral Institute, and he created visceral manipulation. And so again, it means to care for with your hands, meaning we are caring for your organs with our hands. What visceral manipulation truly is it's a manual therapy where we actually work with your organs to make sure that your organs can slide and glide and move properly. And why does that really matter? I'm going to use the liver, and this is our liver here, nice little smiley face and stuff, as an example, just to try to keep it as simple as possible. You know, you have a lot of organs in your body, and they slide with each other, or they should be able to slide with each other, and they have these things called visceral ligaments, which are just connections. A lot of the connections go from like one organ to another. Okay, so like with the liver, you have a connection that goes down to your acin and colon on the right hand side. You also have a ligament that goes down to the right kidney. You have a ligament that goes down to the duodenum, which is the tube after the stomach. You have a ligament that goes over to the stomach. And then on the top here, you have your diaphragm, which is your breathing muscle, which is like a big dome. And so you have a connection over here to it, a connection here, and then like a big crown on the top of the liver that attaches to it. So when you breathe, your liver kind of moves up and down. So if we have any restrictions with the liver or these visceral ligaments, you can affect all of those organs that I just talked about. And for those of you that are seeing us for like bladder issues, there's a ligament that comes off the front and goes down and attaches to kind of your front abdominal wall at the belly button. And then it continues down and it attaches to the top of your bladder. So if we have a restriction up in the liver, we could actually create some bladder issues, right? And so again, visceral manipulation is trying to make sure that this liver per se can slide and glide and move and not cause any restrictions with all of those organs that we just talked about. The other thing that visceral restrictions can do is they can cause like more orthopedic problems, more musculoskeletal problems. Like your body's going to hug the restrictions around an organ and cause problems with your neck and your back and your shoulder and your hips and your pelvis and those types of things. The other thing that can happen with this liver or any organs is if it's restricted and it can't move, it can compress on your vasculature, your arteries and your veins, and your lymphatic system. It can also compress on some nerves and cause some pain. And so organs need to slide and glide and move in order to do movement, right? So if I take my right arm and I move it up and out, my liver, along with other organs, has to move up and out with it. Or my brain will say, you know what, this liver that does 500 things is more important than that shoulder joint, and all of a sudden I'm not going to be able to move my arm up. And then the problem with most practitioners is they go and they just work the arm, and that's not the origin of the problem. So the other thing that has to happen with visceral movement is when our heart beats, the organs around it has to move for that to happen. When we breathe and our diaphragm moves up and down, the organs have to slide and glide and move for that to happen. When our digestion happens and we churn food, our intestines, our stomach churns food, all the organs that are attached to those structures have to be able to slide and glide and move, or all of a sudden we have digestive issues or issues with the musculoskeletal system around those organs. That's why visceral manipulation is really, really important. And so the next series that I'm going to do, I'm going to talk a little bit more about what exactly are we really doing when we get a hold of your organ. So stay tuned for that.